appreciate it. One thing I've done on my healthcare journey is I had 16 years at CCH, Colorado Coach for the Homeless, and then I always had this like sister from another Mr. FQ that I thought I might go work for, and that I'd still come back to CCH, and that was Clinica Campesina outside of Denver. And when I went up there and talked about MI, everybody thought myocardial infarction. Nobody had any idea what MI was. And seriously, medical providers, their hair was on fire with interfacing with challenging clients, patients, because really nobody was doing MI. So I kind of did one of those, who you gonna call, Ken Craybill. And Ken and another MI expert developed a train-the-trainer model to educate on MI and spread that amongst 100 medical providers. The BHPs, they already knew this stuff. They weren't bathed in the atmosphere of emergency rooms. Stop drinking or you will die. And it's still a program that's going strong at Clinical, where every new person in integrated health gets the MI training. So pretty cool stuff. And one of the lines of many of the medical providers was, seriously, one of them came to me one day, Ed, MI changed my life. And they were dead serious in terms of making the visit simpler, cutting to the kernel, and really helps that thing. So here's 10 thoughts, viewed from the trenches, and gratitude. So there's so many folks who've helped me on the journey, and there's so many experts in this room. Meet people where they are, when they are, when not to use it, food and water. There's a happiness slide, we all need that. MI as a metaphor, or planting in the spring as a metaphor for MI. Some jaw-dropping phrases that I'll share, advising with permission, a story for folks from CCH. You know I love to tell stories, just one, and then breathing MI. Meeting people where they are. We are all continually blown away at where people sleep. This is after a spring snowstorm, and hopefully that gives us the pause, the space, and the time to really understand that we can't understand what it's like to sleep better. Just an FYI, here's Stout Street Health Center, the view to the north on February 10th, 2021. Temperatures are going to be about -8 in 2 days. The fences surround the streets as city workers move people, throw out belongings, increase overdose deaths. Great article down there, and you can see the slides. It talks about the OD, overdose model, and rubric that shows that. We all know that our folks that we journey with are at food, water, warmth, and rest, and not at self-actualization. And then when they are, this pandemic blows my mind. Quintuple the depression, the anxiety, the overdoses. This is a slide from SAMHSA. This is after a single event. The thing that's challenging in our journey is that COVID is ongoing, and ever more uncertain. When not to use MI? Oh, that's a different talk, not for today. If someone's really escalated, it's not the time. There are times when we can use some, oh my gosh, seems like you're having a hard day, and it can bring folks back, which brings us to my favorite technique is, can I get you some species, pick any of the above, of a cliff or energy bar, and some water. Sorry about the wait. I really am glad you're here. Let me just come back in a minute. This arming power of food and water gets back to Maslow's. Don't let our happiness, Ken referred to this earlier, depend upon anything. I've got some of my beloved medical providers, they're really trying, but their happiness really is depending upon if this person lowers their A1C. They're not singing the Let It Go song from Frozen, and the Let It Be song from the Beatles. I'm just like, please let it go, like that. So sorry for you from CCH, you know I do this. But also don't let your happiness depend upon, this is stressful, this is hard. People come in and they yell, we have a reaction to that. But I can't let my happiness depend upon whether or not they yell or not, or if they follow our advice. So you know what? We prepare soil, plant seeds, water, fertilize, and then let go of that outcome. And for those of us who've been doing it long enough, I've had people come back 10 years later. I have no idea who they are. I have no idea what I said. And they say, Dr. Ed, you said this such and such thing like 8 years ago, and it changed my life. And you know, I want to say, I did. I usually say, that's so cool. These were phrases developed with Ken and our efforts at the other FQ where I was working. That these were kind of greatest hits that we printed off for providers of every ilk. I love the sounds like on the one hand, on the other hand. That's just my go-to. But you know, I love the sounds like meth has so many benefits for you. Jaw-dropping statement. They've never heard it before, right? Soberingly, meth is the perfect drug if you're a woman at 10 p.m. on the streets of any American city so that you don't get raped and you don't get assaulted. That's a pretty serious benefit. So sobering. So I'm just gonna let those percolate. Advising with permission as opposed to jumping in, super helpful. The additional thing I found so helpful is to de-pedestalize us darn, mental health, every ilk of provider, so that we're not advising from on high. Is it okay if I share with you what some smart folks I've known over the years have shared with me that helped them? And it's coming from their peers. And then there's it seems like. This is my story. Long ago, I was lucky enough to work with the Yupik people in Alaska, and I didn't yet know MI. And it is all about body language, tone, pace. The Yupik people's pause time, how long it takes before we're done with the floor and it goes back to them. It's more like 4 or 5 seconds instead of the 0.2 of us, some of us. And this young teenager came in and I could tell she wasn't in a good way. And I just kind of slowed it all down and said, wow, it seems like you're having such a hard time. And I just sat back and listened. And I listened for about 2 minutes. She didn't say anything. And she slumped off the chair onto the linoleum and just put her head like this and sobbed and sobbed and sobbed. And was able to end up sharing a horrible trauma and abuse she suffered in her childhood. And so sobering. And that's part of MI, is reading the room and saying things like it seems like, and seeing where it goes, and being okay with when people cry. And it's a team sport in integrated health that, thank goodness, I get to work with social workers, psychiatrists, and many other members of the team to help with the response. This is not from my dry erase board in my office, because I'm always pointing it to people that our only hope is to live at the intersection of harm reduction, trauma, responsive care, maybe beyond trauma-informed care, and motivational interviewing. And some really smart doctor, I think in San Francisco or California, made this up, who told it to David Munson in Boston, who told it to me. If you're out there, I want to know who made it up. I really think this is has to be our breath. And MI as breath, this is the last hit, is, do it for our own ability to do this work for decades. Because if we don't, it's not gonna go well, and we're gonna be suffering from burnout. And do it for everyone you meet. Oh, and if you decide to don't like go home and start MI your family members without their permission. But talk about it. And this has been an amazing tool for my my adult, I guess they're in their 20s now, children, my relationships, your teammates, and even these emergency room residents who set up a rotation at Stout Street because they cared so much about healthcare for the homeless. They're like, well, what do you do when the entire ER says, oh, you need to go see, I'm sorry, it's hard for me to say this, you need to go see that drunk in bed 32. And they've got a horrible non-MI, non-TIC, non-HR atmosphere. But these residents are like taking this to the next level and trying to change it and having trainings. So we just want MI to be our breath. As Ken said at the beginning, with everything we do, and I really believe it can change our life.